What up? Today we are talking about pails and rails for the hip internal rotation. Okay, so we look at the mobility kind of order of operations. We've done our cars, we've worked on disassociation of the joints so that we move one at a time and not all of them at once. Once we get that down, now we can start getting into the nitty-gritty of how can we gain more space, because we need to be able to control it first before we ask it to do too much. In theory, we've gotten through our cars and warmed up the hip a little bit before we do this exercise. Okay, now we get into our pails and rails position. Okay, progressive angular isometric loading and regressive angular isometric loading. We're going to get our hip in a stretched internal rotation position, and then we're going to drive from both sides of the tissue around that hip joint to tell the central nervous system we can produce force in this stretched position, and that's what's going to get us more space eventually over time. All right? The cadence to this can be a little bit different than anything else you've seen before, so that part can get a little bit difficult, but once you get the cadence of the exercise down, pails and rails is the same in any different position for any joint, okay? So we're going to start down on our side in the sideline position. Okay, this yoga block is actually going to go in between our knees here just to get to keep that neutral hip alignment, and then we're going to internally rotate the hip here, that rotating down to whatever we can get here. This needs to be adjusted for however high or low you can get it. These are basically going to be isometrics. I can come off a little bit, but in best case scenario, we're in as stretched of a position as we can. Feeling it a little bit right here, right away. Okay, so the two movements that we're going to do are external rotation into our block here. Okay, and it's an isometric, so we're not going to go anywhere, but we're going to build up tension. Okay, so what I'm going to say is inhale, trap that air low, squeeze this leg, and with 10% effort, we're going to externally rotate into our block here. Okay, we're going to build up some more tension, going to about 70% of our maximum voluntary contraction, which is as hard as we can go, so just about 70%. Okay, so 30, 50, 70, and hold. We're just going to hold for 5, 4, 3, 2, 1. Now we want to use the other side of the tissue, so regressive tissue, internally rotate, trying to come off the block if we can. If we can't, that's fine. They're supposed to be isometrics when we're at our full range. And hold for another 5, 4, 3, 2, 1, and we're down. That regressive tissue might get a little crampy here for you. Okay, so when you can have it, you can have your head resting down here. You don't have to prop it up like I am here. You can have another yoga block if you want. Okay, so we're going to go one more round here, so listen to the cadence. We're in a good stretched position, everything is silent. We're going to inhale, trap that air low, build out tension through the rest of the body, and with 10% effort, we're going to dent, externally rotate, and dent our block here, and try to put more and more pressure. If that block wasn't there, it would just go straight down this way. So bring up pressure, 10%, 30, nothing changes here, 50, 70, and hold for now 5, 4, 3. Now this is really hard. 2, don't let anything else move. 1, when we go the other direction, really gonna feel it here. 5, 4, 3, 2, 1, and we're down. Whew. Getting a little crampy there. Now, we can do that for all types of different variables. We can go up all the way to 100%. We can hold for a longer period of time. The more aggressive, perfect stimulus that you put into the exercise, the better results you're going to get. But if we're new to the exercise, we shouldn't be doing 100% because realistically we won't be able to do 100 because you don't know the exercise well enough. So we want to make sure we're just getting to about 50 or 70% of our maximum voluntary contraction, making sure we're feeling it in this right hip or whatever hip we're on, this lateral hip, in that regressive tissue. We're not feeling it in the knee driving from anywhere else. 3 rounds, 5 to 10 second holds each direction, and that'll be a great place to start to get those hips a little bit more work.